Now we come to our three future shapers. You may speak as speedily as that if you wish, because this is the kind of the elevator pitch moment. So I would like you please to give a very, very warm round of applause to, first of all, Tim Houter. Did I do that well? Oh, Tim Houter, please join me, of Hardt Global Mobility. This is Europe's first Hyperloop company and a recipient, well, you probably know this, at Elon Musk's SpaceX Hyperloop pod competition. You may take a seat for just a moment, sir, if you like. I'm going to get you all on stage. Everyone heard of the Hyperloop? Hands up. Oh, you're in for a nice surprise, these people there. Something very different. We're going from there to there. We've got Lynette Kucsma, yes, who is CEO of Natural Machines. Please come and join me. Now, this is a Spanish manufacturer of 3D food printers, okay, and other Internet of Things kitchen appliances, and I believe was named by CNN last year. You were named as one of the tech, it said superheroes, but I say superheroine. Superheroine to watch.
That counts.
Okay, you may just take a seat for a moment. A warm round of applause, please, for this lady. And again, somewhere from there to there to there, we've also got Stephen Dunne. He is Managing Director of Neurolectrics, which is a company working in digital brain health. I think you can see that from here. And the founder of your company received the EU Prize for Women Innovators, I think, from the European Commission previously. Do you want to join? Yeah, in 2004. Okay. So, you are going to demonstrate now to these good people your innate dynamism. You've got 3 minutes in which to present yourselves and your project, and then we will get together for a 15-minute tete-a-tete, okay? So, the audience is agog. Are you ready? Yay, bated breath. Okay, the stage is set. Join me, Tim. And, sir, your time starts now.
All right. Well, what if you can travel from here to Paris or London or Berlin in minutes instead of hours? What if you can go and work all around the continent and still return to your family each end of the day? What if distance simply just doesn't matter? Well, exactly, that's the world we're making a reality with the Hardt Hyperloop. Ladies and gentlemen, my name is Tim. I'm the CEO and co-founder of Hardt, and the next couple of minutes I would love to share with you our vision and how we are making this a reality. At Hardt, we envision a world where you can easily travel all around the continent. And mobility has evolved greatly throughout history, but the demand for fast and efficient transportation has never been higher than now. But where do we turn to? Now the roads are full, the trains are clogged up, airplanes are expensive, inconvenient, and worst of all, horrible for the environment. The world needs a mobility solution. And that solution, that's the Hyperloop. It is faster than airplanes, cheaper than trains, and it has 0 emissions. But how does it work? Well, imagine a normal train, but then with single autonomous wagons departing all the time. They travel inside a vacuum tube, so it's protected from the weather. And instead of wheels, there is a magnetic suspension and propulsion system that makes it possible to travel very comfortably at more than 1,000 kilometers an hour. The system can be put on pillars to cross any terrain, or it can go underground, crossing cities, mountains, beautiful landscapes, completely unaffected. And this might sound a bit too futuristic, but actually, it's going faster than you think. Let me show you our progress. Because in 2015, Elon Musk announced a worldwide Hyperloop design competition. And for this competition, we created a working prototype and managed to win this competition. And afterwards, we started hard to further realize the Hyperloop. In the same year, we unveiled Europe's first full-scale Hyperloop test facility. And currently, our team has turned into a multi-million-euro Hyperloop company consisting of great people with experience in building race cars, rockets, and managing huge progress. The next step, that's a high-speed test facility to test every single system before you're going to connect 2 cities. And currently we are working on this together with the Dutch Ministry of Infrastructure and Environment and a dozen of other parties. So as you can see, together we can make this a reality. And therefore, join us in this revolution and making this dream of this well-connected future a reality together with us. Ladies and gentlemen, my name is Tim, and it is my dream to let everybody travel at the speed of sound in a hyper-connected world. And please feel very welcome to have a chat with me later and grab a thing together. Thank you.
Very, very good. You are much better than the politicians I have on panels at sticking to time, I can tell you that, and I think you delivered that at the speed of sound, speed of light.
Speed of sound.
Speed
the
of
light
sound.
is maybe
yeah,
the next
sorry. I shouldn't really be the moderator, should I? Thank you very much. So, very interesting. I will have many questions, but we'll talk about those in just a moment. So let's go something very, very different. Lynette, do you need to come over this side? Shall I shift?
No, I'll
or you're
around.
doing
It's
in the
fine.
middle? You don't need to go. Perfect. So, ready, steady, go.
I don't have slides. I'm going to ask you to use your imagination. So hello. Envision yourself walking through a supermarket. What do you see? I know you're going to see a lot of processed packaged food on food shelves made from food manufacturers. And when you pick up those packages and you see the back, the ingredient labels, you're going to see a lot things that create a lot of questions. You'll see additives, preservatives, E-numbers, chemical-sounding ingredient names. We literally don't know what we're eating at times. And even if you get a package that has a clean label, meaning you understand every ingredient in that box, what you don't know is how much of that ingredient you're eating. So we typically eat way too much things like salt, oil, and sugar when we eat something that's from a food manufacturer. But how does a food manufacturer make food? They basically take ingredients, they take food, they push it through machines, they shape it, and they form it. We've taken that exact same concept and we shrunk it down to a design kitchen appliance. This is Foodini, a 3D food printer. The big difference from this, from a food manufacturing facility, is we allow you to use your own fresh, real ingredients. So what's a 3D printer? It's a buzzword a lot of people are using, but a lot of people don't know what it is. So a really easy way to understand it is imagine an inkjet printer and you're printing the word hello on a sheet of paper. Now imagine that sheet of paper gets stuck in your inkjet printer and it keeps printing the word hello over and over and over again, building up the word till you get a 3D printed hello. That's exactly what we're doing, except rather than using ink from an inkjet printer or plastic or metal in typical 3D printers, we're using food, fresh, real ingredients. Now fast forward in your minds 10 to 15 years from now. We believe that 3D food printers will become a common kitchen appliance in everybody's kitchen, similar to how a microwave or an oven is a common kitchen appliance in today's kitchens. It's designed to get people away from processed food back into kitchens, targeting on macro trends of knowing where your food is coming from and what's in it. Your kitchen will become more intelligent. One reason is because Foodini is not just a 3D food printer, it's also an Internet of Things connected kitchen appliance. That means data. So there's a lot of fun things you can do with that. So with your smart kitchen, wearables will become smarter, data silos will start working together to get data together. Your Fitbit might know that you went for a 5K run this morning. Good on you. But you might also be low on vitamin D because it was cloudy outside today and you might need additional iron in your diet. You'll be able to personally print a customized breakfast bar that's upping those nutrients in your breakfast. So the future of food in our vision is still very much real food, but it's customized. So getting away from the generic foods that are on shelves in supermarkets today and getting back to real food that's 3D printed and personalized. Thank you.
Thank you. You talk about intelligent appliances, intelligent kitchen. Will it make us more intelligent?
It could. IoT can
Depending
do a lot of things.
Depending on the right nutrients. If I don't shove a load of chocolate in my breakfast bar. Okay. Thank you. We will talk further, much more about that in just a moment. Stephen, something totally different.
Totally different.
But, however, Lynette, actually, the Foodini is being used in a healthcare context already, so I think you're going to take us more broadly into that domain. Thank you. And your 3 minutes start now.
Okay, hello everybody. I'm going to start off with a little bit of bad news. 1 in 5 of you will at some point in your life have to deal with brain disease. If we include things like mental health, neurodegenerative diseases and stroke, 1 in 5 of you. For the over 65s, that number goes up to 3 out of 5. The impact of this socially and economically is going to be massive. If we look at the aging population in the West, by 2040, 1/4 of the population will be affected. And the cost of care will rise into the hundreds of billions of euros. Okay? There will be some good news. Unfortunately, there is no cure to these diseases at the moment, and the treatments are not ideal. Basically, they're unimodal pharmaceuticals, drugs. You take a tablet. They're not targeted at the brain. They affect the entire body. They're not personalized. Everybody essentially gets the same treatment. And they're very, very open loop, which means you take a dose of something, you see how it works for a few weeks or months, you come back, you adjust the dose, you see how that goes, you adjust again. Very slow, inefficient process. But we think there's a better way. So with this in mind, we developed some new technologies, which you can see over here. Basically, we have a device that can read and write the brain electrically. We can read brain activity, so brain waves, which I'm sure you've heard about, but we can also modulate that activity by injecting currents into the brain and creating electric fields. There's a few important points about this technology. Basically, in the past, you could stimulate the brain with 2 large, wet sponges, but it was like a huge on-off switch. We have a lot of small electrodes that allow us to manipulate the electric field to target specific areas on the brain. We also develop realistic models of the brain and look at the physics of what's happening when those electric fields are interacting with the neurons. And then, as I mentioned, we have read-write, so in the same device, we can see the effect of what we're doing, which is closed loop, the opposite of the open loop system. So, with all of these things, what we're proposing, instead of the old treatment, we have multimodal treatments, not unimodal. We can combine this with pharmaceuticals. You can combine it with physical therapies. You can combine it with nutrition. You can also, target specific areas of the brain. And you can personalize it, because this model that we developed can be based on the MRI of the actual patient. Now, all of this technology we put together in a platform that you can take home. We designed it to be wireless and wearable for that reason, so it's easy to bring home. We have a cloud platform that allows you to monitor compliance remotely. And up to now, we've been selling this into the research market, over 45 countries so far. And we're working on clinical trials in Boston on epilepsy and cognitive impairment to begin with depression coming down the pipeline in the next couple of years. So we really believe this is the beginning of a new digital brain revolution. Thank you.
Okay, we don't need to get closer. We're all right. Do you want to shift? Do you feel a bit far away? Yeah, come on then. Here's the chairs. They are ridiculously heavy. Oh, yeah. Okay, we're there. All right, do you know what? You spoke last, but I'm going to ask you a question first. We've got just 15 minutes, so I'm going to pretty much keep the chat amongst ourselves, because you will stay there, I presume, for... There's Hendrick's Gin. You cannot possibly run out of this place without gin and tonic. And so all of these good people can come and talk to you, I hope, afterwards. And then
Definitely.
The final panel debate, I'll open up to the floor, just time constraints allowing. So just a question, because we chatted before. Yep. What I obviously picked up, but we'll come to that in a minute, is the personalised nature of both of what you talked about. But I think what would be interesting is, we're talking about brain, we look at sci-fi films, it's very personal, so we can hear all of that about the benefits, we know about the demographic challenge. But I'm curious as to what has been the main response thus far, both from stakeholders and consumers and from the media. Yeah. And also you talked to me about how you pitched it, how you decided which direction to go in.
Well, to start with the last point, a few years ago we had the option of kind of going the consumer route and using this technology to work on things like brain-computer interfaces for gaming, for sport, for cognitive performance increase in the general sense. And thinking about kind of the ethical implications and what we knew about the science at the time, we decided to be a medical device company. Mm-hmm. So that was a conscious decision that we took to make sure that we understood what we were doing before we got to the point where we were offering it to consumers. Okay. So there really was kind of a moment when that wasn't clear, and we decided we would go the medical device route with that in mind, which obviously then forces us to comply with regulation and think about the safety aspects in a different way. But for us, that was a very important kind of change or moment for the company.
And did you notice any change in I know you're still in trial stages at the moment. I mean, did you notice in any change of perception people are more comfortable with the healthcare, the science side, rather than the consumer side?
Yeah, very much. And like when I talk about cognitive impairment, people are very comfortable with that notion, that you help somebody with cognitive impairment. Mm-hmm. If I say I can help you improve your cognitive performance for a healthy subject, that's completely different. Okay. And people start to worry about the inequality of people that can afford that versus those that can't. Mm-hmm. So for us, it was almost like an easy way of dealing with the problem, because we knew it would be such a big problem for us down the road, that if we took a step back and said, okay, we're definitely going to go the medical route first, really understand what we have in our hands, then we don't really have to deal with that issue as a company. Some people are going that route, and it's going to be very interesting to see what happens in terms of regulation. We've been involved in a few discussions with the FDA where they're balancing whether they're going to regulate all the other people or not, and say that actually that is a medical device too. So that could happen.
Okay. I'll park it there, but very interesting, and I think it's very interesting you made that choice. And again, because a lot of this as well, the conversation is about perceptions as well. You know, how we heard about transitioning, accompanying, you know, the public, informing the public. But if we stay in the domain of healthcare for a moment, and I spoke to you, so I know you didn't get a chance to say that this is used by a lot of Michelin-starred chefs, so it's well, some very top high-end chefs, but also in the healthcare domain.
Right.
So have you found that there is this perception between, hang on a minute, it's a bit decorative, or you're telling me it's not about ink and metal in a traditional printer, but sorry, it's all a bit plastic. How on earth can you tell me that I can personalise my food in a way that's beneficial for my health?
Yeah, we understand that when we talk about technology, people tend to put food on one side, technology on the other, and they don't want to cross it too much. But at the end of the day, it's really a kitchen appliance, the way we describe it. But with the healthcare and the hospitals, they're using it for specific use cases, for medical cases, so it is being used in hospitals today. But on the flip side, it can go to the Michelin-starred chef level, where it's all about food presentation. The thing with this kitchen appliance, and any kitchen appliance, if you think about it, your refrigerator, your microwave, your oven, they're in many different environments, and they do more or less the same thing, but there's different specifications in different markets that can be applied. It's the same thing with 3D food printing, and even more so because you can do so much specialization and customization of foods that's personalized to you. So there's a lot of different use cases for it.
And just to pick up on, and I will come on to you, to pick up on this issue of data, because you said you got data flow. Again, you know, that's obviously, you know, we had a chat before and you said something very interesting. You said, well, you know, there could be that people, when they think about data flowing through that appliance, they think, hang on, is it going to affect the waiting time that I might have in a hospital? Or, you know, there was a kind of a link there. How are you looking at and shaping and dealing with that whole issue of data protection?
We're very aware of data and all the complexities that go around it. And listen, we're a startup. We're 5 years old, but still classified as a young company. But we find that, you know, there's no one right answer today. We don't have everything solved with data today, but we do look to partner with experts that has expertise in protecting data and in doing things with data to make sure it's safe. And our kitchen appliance is really a vehicle to utilize data to make smart choices in terms of food and data monitoring or dietary monitoring. So we know we can't do it all by ourselves. There's too much complex issues and too many things that keep constantly changing. So we look to partner with the experts that have specialization in that field to make sure that people feel comfortable with what we're doing as well. And of course, giving people the option. Maybe you don't want your data flowing to your doctor, or you don't want to work with a nutritionist. But then there's also the trade-off of functionality. If you want to print a dessert that stops printing when it hits 200 calories, for example, we need to know what you're printing, because that's the way it works. But there's the data flow behind that. And you can do that, by the way.
I personally want a dessert that tastes like 900 calories and actually has about 4 in, but that's okay. So we're looking at perceptions with you, and you said that was interesting when you made that choice between the consumer avenue, and you're going to be keeping your eye on those because there's conversations about regulation there. And we're looking at that, the use of data and personalisation and sort of how you present it to the public, you know, public fears. Now, that's a biggie. I mean, I know from reading up about you that some of your work is obviously not just about explaining what it is and the mechanics, but in the whole social uptake of it. I mean, where's your responsibility? How do you explain it in that sense? And surely you've got big issues around security in the most basic sense, breaches or problems with you know, that form of transport, the materials. Tell me about that. How do you explain it to the public, and how do you mitigate those fears?
Yeah, first of all, safety is one of our top requirements that we take into account to actually realize a safe system. We're now working, we're currently in the prototyping phase, so we have an internal procedure to make it as safe as possible. Also, one of our supervisory board members, he's the former CEO of one of the Dutch aerospace companies, so he has a lot of experience in making things extremely, extremely safe. But next step is to work with the government towards a standardized and a certified system that is as safe as possible, because safety, that's a top prio for a new transportation system, and it is really our goal to create a transportation system that is faster, that is safer.
And you mean safe in terms of materials and also safe in terms of potential attacks, as any transportation system is.
Exactly.
You mean safety in the full sense of the word, right?
In full sense.
Yeah.
So that's one. And second is that Hyperloop can be used eventually by anybody. It's not really for the top elite. It's really for the daily commuter, for the daily leisure traveler. And because the system is faster than airplanes. It can be cheaper than trains, the current transportation system, and it's much more CO2 CO2 neutral. So therefore, it can really enhance the current transportation system and be used by everybody around the world.
Okay, so if we just stick with that, and that's, you know, that's how you explain it, and you are being cautious to look at those aspects because I guess, you know, you have, I mean, it's a no-brainer. Let's just, I've just totally lost my train of thought there. Yes, it's back. It came back. Responsible research and innovation. I do a bit of moderating around this. Very interesting topic. So when we're looking at, you know, that's these areas where the public is implicated, we're looking at safety. On the one hand, we're looking at prosperity in the widest sense. Is it socially beneficial? Is it, you know, we were talking about this polarization at the top, but you've got this social mobility. If we look at all of those different areas, how much are you engaging, each of you, as innovators? Here you are, oh, ping, I've thought this up. How much are you engaging the end user in your process of innovation, and when? Yeah,
already from the beginning, we are encountering the end user a lot in our current developments and in our pitches and talks to potential stakeholders, because eventually they're the one that is using it, and they want to use it as convenient and as safe and as cost-effective as
and is it quite broad and diverse? Is it a broad church of input that you, from all kinds of users?
Because
there's criticisms, just to say, there's criticisms that this could be for the elite, that will be way too costly.
Exactly. So therefore, it's a system that can transport everybody. It can be used on a daily basis also for going to and from your work, and therefore broaden your region where you now can currently live and work in. And therefore, you can actually create a whole continent where it doesn't really matter where you live and work. You can just go there, travel this whole continent as easily as you can now travel within a big city with a metro, for example, to really create a world where distance simply just doesn't matter.
Okay, so you're saying it's open and accessible for all, that you have engaged. What about your engagement? Does your project, the size of it, how it started, did it necessitate that kind of sort of responsible garnering feedback at the outset, garnering input?
I think there's a balance between innovation and seeing what the market wants. Nobody knew they needed an iPhone until the iPhone came out, right? So you have to do some innovation sometimes to show people what can be possible. You can do personalized food in an easy-to-do format. Maybe people didn't know that before. So I think innovation and what people want or what they feed back has to come together. So right now we are manufacturing, we're out in the market, but we are in a business-to-business market right now. There's a couple other features we're developing that will get us to the consumer market, but there's a path we need to follow. You know, we can't go everywhere all at once. So basically evolving the technology, getting user feedback, making sure their concerns are met. One of the biggest criticisms, well, we get a lot of criticisms because, as you can imagine, food is very emotional. So you tie that together with technology, you blow up the emotions. So we have people from the lovers to the haters and everybody in between. We're pretty proud of the fact that we can neutralize the haters in 2 communications or less. I say communications because it usually happens over social media. So in 2 communications or less, we can neutralize the haters. Because people just automatically think 3D printing, that means plastic, that means fake food, that means this is garbage you're putting in the market. And that's not the path we're following. We're putting it totally upside down on its head. And I personally understand when people think that, because quite frankly, I thought that myself before I joined the company. I automatically thought 3D printing is fake food, it's processed, it's artificial, why do we need more of that? But we totally flipped that where it's not. So there's a huge education standpoint that needs to happen, and it's part of the reason why we call it a 3D printer. It's more technology in there, it does other things, but it is a 3D printer, and we understand that creates controversy, but it creates controversy to get the discussion happening, and that's what's really important at this stage.
And I think, but this is also, discussion is happening, but it's how those discussions happen, because we live in an age where there's a lot of ranting, and that's obviously, I mean, that's why I started off by saying to you, about this issue with media. I mean, you talked about garnering input and feedback, you talked about having had a diversity of input, but I think yours is going to be more than feedback, it's going to be right at the front end, isn't it?
So
because,
we came from kind of a research environment where these were forefront when you're applying for grants. You have to talk about or think about these things at the very least. So we decided early on to get very involved, and we started working with the Oxford School of Philosophy. They have a neuroethics group. So we started working with them, thinking about what the implications of the technology would be, and we organized events, we got feedback from the public, and we have ethical oversight basically for everything we do. We have a project running right now on consciousness, where we're trying to measure the level of consciousness, which has all sorts of interesting ethical implications around Like the simple case is in anesthesia, sleep, coma. Can we measure it? Can we help you come out of it? But can we measure the level of consciousness of a fetus in the womb? Can we measure the level of consciousness of an animal? If it's comparable to a human at a certain age, what does that mean for animal rights? So all of these questions are implicit in
it
the
must
research.
open up a whole Pandora's box, and you've got to pre-think all of this whole Pandora's box. Okay, again, so you talked about, I think you used the word educating, informing. We talked about accompaniment, transition. It's got to be a caring state. We can't just shove things out there. And this link between sort of legislation and innovation, how does it sit? Directing, I think you called it, the professor called it. Just sort of taking innovation sort of pure at the moment, and because we talked at the beginning about we're in sort of at the moment in this EU ecosystem here, do you have any experience of the sort of the Europe-American approach? I mean, very, very in a nutshell, it comes up at every, I don't know whether you have, what do you see? Where are the pros and cons? Where is Europe, flying the flag? Where could it do less, more? Tell us about that.
Yeah, currently we're working with the Dutch government to enhance the Hyperloop developments. But I can imagine in Europe the discussions are very difficult to do between all those companies. What you, for example, see in America is the private companies. They have a bit more stuff to say and really go for it, raise a lot of money and make it a reality. And that's also what we now see with the Hyperloop developments in America. They're going a bit faster than they're going in Europe. They have a bit more support. And what we now really try to create is an environment where different companies, also big private companies in Europe, can join in this development and say, well, this is something that we support, that we also want to make a reality, and therefore European government support this and try to make this a reality together with us before all of the American technology tries to overrule everything.
So it's a bit like who's going to put the first man on the moon to an extent.
Exactly, some kind of feeling like that.
Yeah, okay, except horizontally, not vertically in your
Exactly.
case. Okay, for you, what have you got any, are you selling, is there any chefs in the States that are taking this on? What's your...
Any chefs where?
In the States, I said, who are taking it. What's your have you any flirtation with the US market?
I'm American in case anybody hasn't picked up on that yet. I'm an American living in Europe, so we're a bit playing both sides of the field, if you will. So we work globally. We have America, Europe, and China are the big markets. So there's pros and cons, I think, to being in Europe versus being in the States and vice versa. There's always goods and bads everywhere. So we do have chefs in the US using it. We're doing global standards and making it a food grade,
Okay, you are doing, okay. Because here there's tight ones, okay. Whereas it's not quite the same, is it, in the States? I mean, here we are, particularly in the domain of health and traceability and transparency and provenance of food and organics. Europe is pretty hot on that.
Yeah, which is fine. That's really what we deal with. So the fact that we're based out of Barcelona is ideal. There's a lot of Mediterranean food, fresh food, Michelin-starred chefs, a lot of quality ingredients. But at the same point, sometimes the Americans are a bit more apt to play around with technology and food more and take it on faster and give more. That's where we're at with hospitals, actually. It's in the States. It's not in Europe right now, although we are working with hospitals here as well. The States is more advanced with that right now.
More quick, bit more go and grab it. Okay, and the last to you, please.
Yeah, so what I mentioned earlier about this decision we made, that was actually almost a decision between the Silicon Valley way and the European way. And we were getting advice from Silicon Valley telling us to sell it to gamers, make your money, and then circle back and do the medical device and figure out how it works. On the European side, it was the opposite. It was like, be careful with this, you don't know what it is, start with the medical device. And then later you can be the medical company that puts their seal of approval on the consumer device when everything has settled.
Right.
So that really was, there was a lot of tension between the two. And we met in the middle and set up in Boston, which was kind of closer to the European idea of doing business than the Silicon Valley. And we're running our clinical trials in Boston for that reason rather than on the West Coast, which was an option at one point.
Okay, interesting. Interesting to hear the different choices that you've had along the way, which was all part of the debate we're talking about. Okay, I have exceeded the time, but I'm allowed because I'm the moderator, but it's absolutely ridiculous to have such a short time with you. And for me, very fascinating that when you look at the word innovation, look at the total breadth. I mean, it's just quite staggering, isn't it, how different these are. but also where the overlaps are in terms of the informing the public, engaging, in terms of what are the social benefits. I mean, you said, just you can go any distance, you can get into other cultures. So all of those different benefits. Just before I release you, in 3 words, it could be 3 nouns, full stops between, or verbs, or a mix of verbs and nouns, or adjectives. I don't mind what you do. What sort of 3 things, if we're looking at this whole issue of safety and prosperity, what are the 3 words that come forth most for you that you will put out there?
Limitless human connections.
Limitless human connections. Okay.
Fresh, personalized food.
Fresh, personalized food. Okay.
I think for me it has to be science-based innovation. We need more
science-based innovation. Okay. Thank you very, very much. It's an absolute privilege to have you here. I'm sorry I didn't have more time with you. Can you please give them a very, very warm round of applause? Thank you.